Bipolar disorder is a big scare today. Dr. Basu, what has been your experience?
So bipolar disorder has a prevalence of about 1%, 1 to 1.5% worldwide. So if you think about the fact that India's got about 6 billion people or in excess of that, that's a lot of patients with bipolar affective disorder. There are two types of bipolar affective disorder. There's one which is called bipolar 1 disorder. That's the classical manic depression psychosis, and when patients are manic, they're doing things that can be quite risky. So they might empty their bank accounts because they think they've got a lot of money. They might get quite sexually promiscuous, which is a problem, because then you have unsafe sex with a lot of people that you didn't necessarily mean to. And then you might be driving erratically, which can again be a problem, not just for yourself but for other people as well. Besides, people with bipolar disorder in the manic phase, they can really be confrontational, particularly if the loved one or the person that they're living with confronts them about their behavior. And then potentially there can be arguments and violence even. So that's part of bipolar 1. The more sort of difficult period for bipolar disorder is the depression. Because the depression is a condition in which you feel completely void of energy, as opposed to mania, where you're getting lots and lots of energy. In depression, you feel completely void of energy, you lose interest, you lose the ability to focus even on something as simple as a television program. You might not want to eat, you might not want to drink, and it can be quite complicated as well. So bipolar disorder can be a really tricky disorder. There are less severe forms of bipolar disorder, which are not as complicated as the historical or the traditional bipolar 1. And there's another disorder, which is emotionally unstable personality disorder. It's really important to make the distinction about this, because emotionally unstable personality disorder is a disorder that happens mainly because of attachment problems in your earlier days, and it can lead to a sense of confusion about who you are, recurrent self-harm, regular mood swings. So it's important to get that distinction right, because there's no point treating somebody with mood stabilizers if you've got emotionally unstable personality disorder. So it's an important differential.